Hi, this is Junaid, AINeuroCare stroke and epilepsy specialist. Today we're going to talk about a very important topic, and it should be on the top of your mind when you're deciding your specialty or subspecialty, and that is burnout. It is termed colloquially used burnout. I don't like it. I use the term moral injury, and we're going to come to it why and who invented that particular term. And I think this is the best term to use as far as defining burnout. And the reason behind it is that the burnout specifically means that there's intrinsic problem. However, moral injury defines it as actually an extrinsic issue, which it really is. World Health Organization defines moral injury as a chronic workplace stress in which you are basically in a workplace situation at a chronic level, consistent, constant, you feel stressed out. And this is not just defined for medical and healthcare professionals. This is an overall industry term now. And there's, of course, moral injury burnout in software engineers, etc. All other parts of life can actually have the significant issue. But here in the context of medicine, it is becoming an epidemic of problems. So what does it really mean to have burnout or moral injury? The first and foremost is the feeling of exhaustion. You feel that your energy is completely depleted. You feel like your soul and your body, it does not correlate with what you need to do at that moment in time. The second and the most important one is cynicism. It is the feeling that somebody is out to get you. It's a feeling that you are not working as a team. It is a feeling that you are going to be persecuted for anything, maybe even someone else's mistakes. And unfortunately, especially here in US, the medical legal system, the malpractice environment is significantly bad, and it does for sure lead to a significant feeling of cynicism as part of the workplace. And the last is ineffectiveness. When you go back to work, you do not feel like you have achieved anything. You feel like you have just that completed paperwork. You feel ineffective to create an impact on your patients' lives. Now you have to understand this is not just a US problem, it's a global problem. There have been multiple studies in multiple countries that have identified a significant burnout moral injury issue both in nurses and physicians, leading to all those three symptoms. In 2018, there was a survey of American physicians that defined that there are 78% physicians that are currently suffering from burnout. In 2016, it went up to 4%. And moving forward, especially COVID and post-COVID, these levels are now extremely bad. In UK, it is up to 80%. It's significant, it's huge. There's a problem that is very big, and therefore, National Academy of Medicine created this report in which taking action against clinician burnout, in which it identified that nearly half, 35 to 40% nurses and doctors have substantial symptoms. 80% and 70% are basically where throughout their career, they have had symptoms of burnout. These are people who have substantial symptoms that are impacting their lives on a daily basis because of burnout. And it's just not a feeling, it's just not a mental disorder. It has huge implications, both in terms of patient safety because medical error goes up, and in terms of lost revenue because you're ineffective and therefore you're not doing the job correctly. And it has significant losses in billions because of this issue. So there is a clear problem that is impacting at a personal level and financial level for both institutions and literally at a level of countries. Now going back to why you should use the word moral injury. Now burnout basically means that I have something intrinsically, a problem on me that means that I am unable to perform and therefore I am cynical, I am ineffective, or I have depleted energy. Moral injury redefines a problem as a problem of a chronic workplace, which is also external in origin. Moral injury is simultaneously understanding the challenge, understanding the knowledge that what the patient needs, but unable to provide it because of institutional constraints, systemic constraints. And therefore, when you are a physician who has joined this field to make an impact and you are unable to do so on a constant chronic level, then you feel moral injury. In this particular article, he actually defines it, he actually creates a parallel to post-traumatic stress disorder rather than a burnout, and therefore moral injury is a more appropriate term of a post-traumatic stress disorder in clinicians. Now let's understand how burnout affects you. There are two sides of the coin over here, professional and personal. Let's talk about personal first. It is clearly a big issue, and I keep telling you that medicine is a way of life, and this is why. Because it is such a demanding way of life in itself is that it has significant impact on your relationships. And therefore, there's a significant way that you can have broken relationship, divorces, etc. This hugely impacts personally. And if you're really doing a job that feels you ineffective, cynicism, and you feel like you have depleted energy, that is going to spill over into your personal life, and you're going to have a significant impact on your relationships as well. There's an increased risk of substance and alcohol abuse. Unfortunately, there's a significant risk of depression and suicide. So it clearly does impact your personal life. Now let's talk about professional life. The key issue that really comes through is that you end up decreasing the quality and increasing medical errors. There's clear evidence to it that if a physician works and feels burnout on their job, they will have increased risk of making mistakes and having medical errors. And this is a significant problem for medical legal problems, as well as a vicious cycle in which you continue to make more burnout, more mistakes, and unfortunately, this results in decreased patient satisfaction. Now, think about it. If you're going to feel yourself being ineffective, at the end of the day, you cannot project confidence in your patient's care. And when you're not projecting confidence in your patient's care, that patient becomes less engaged and therefore less satisfied. And this, again, as I said, leads to decreased productivity. And unfortunately, this also leads to significant physician turnover. Now, let's talk about physician turnover for a second. Let me give you one statistics. To get a physician hired in the United States, hospital systems on an average spend $110,000. That's huge. That's a significant financial cost. And it's all not only for the hospital systems. If a physician is moving away, it has their personal cost as terms of moving expenses, changing schools for their children, etc. So this is becoming a huge issue both on the person and on the systems as well, because there's this level of iteration cannot continue and people have to have their lives with their job satisfaction. Now let's get back to what are the three things that are problematic and how do you get there. So the three things that I talked about: exhaustion, cynicism, and ineffectiveness. And what you really want to achieve is a level of vigor, a feeling of dedication and a team player, and a feeling of effectiveness, and a feeling that you are providing the care that you want to provide. And that's the first and foremost. You feel that you have meaning in your work. And that also all revolves about how your work-life balance is integrated. What is your social and community support? Is your core values are in line with your organizations? What are the efficiencies and resources that you can have to take control of the patient care back? And that's the key term, control and flexibility, that you feel that you are actually being effective. These are the things that we're looking for. All these resources again are on Academy website, and this is from Mayo Clinic, available as open access, so you'll be able to download the whole PDF. As I told before, burnout has a significant impact on your personal relationship, and therefore it is important that you do understand that how important it is, and also take into consideration when you're choosing a medical specialty. It is actually reported higher in millennials as compared to baby boomers, but is significantly high, above 70%. It definitely impacts your relationships, and therefore you have to make sure that you and your significant other understand the demands of the job in the future and make plans accordingly. This is a few sentences that I'm just going to read because this is a little heartbreaking, but at the end of the day, you need to understand that why it is so important. I get angry easily. I dread every shift. I am frustrated, cynical about patients. I find myself becoming a doctor and a person I don't want to be. And this is very important, and I've personally witnessed this. I mean, being in the medical field for some time, especially in the leadership position, I've seen these issues prop up a lot. As a matter of fact, physicians become angry, they shout, and then the complaints go back and you have to deal with those complaints, only to find out that the physician in itself is having significant problems with burnout. So what are the specialties that are most impacted by burnout? Now, these studies have been done by Medscape, and by the way, they change from year to year. Here we want to understand the overall understanding. What is the reasoning behind these different subspecialties in which you're actually having burnout? Now, the most pervasive one is in critical care, and that has been on the top of the list for the past 3 years, at least what have been looking at the Medscape reports every year moving forward. Now, critical care medicine, unfortunately, you're dealing with patients with acute issues. Families are not happy. You have long hours, and you are constantly under stress of having to respond to issues that can be life-threatening. Clearly, with these long hours and with these issues, there is a significant level of burnout that these subspecialties actually experience. And part of it is also like, for example, I'm a neurocritical care physician. I mean, neurosurgeons are actually performing at their best, but at the end of the day, the patient ends up in the ICU and you are responding to emergencies first, although clearly any hyperacute emergency situations are at a significant risk. So this is a bucket in which hyperacute subspecialties are most at risk, and not just critical stroke physicians, emergency medicine, other subspecialty fields in which trauma surgeons, etc., are a big bucket in which they feel the most amount of burnout as far as burnout is concerned. Second fields are in which there is clearly the patients have a significant chronic issue and you see debilitation of the patient and unable to help them. For example, dementia people, right? So you can see multiple sclerosis, rheumatology, etc. These patients actually debilitate, and therefore you are ending up looking at these patients and unfortunately having not to be able to do much about it, and that's actually sometimes a big source of burnout as well. Specialties where you have decreased pay and significantly decreased pay, and that's one of those generalists like internal medicine and pediatrics. I don't understand, for the love of God, why these people are not paid well, because this is truly the backbone of preventative medicine, and this could actually have huge value. Believe it or not, in US we only spend 5% of our whole healthcare expenditure on primary care, and this is too low. This is a big systemic issue that I keep talking about, and therefore, again, when you're choosing your subspecialty, you need to take these things into consideration. So let's talk about what really contributes to burnout. The first and foremost is too many bureaucratic tasks. Oh my God, this is just ridiculous. I don't know about other countries, but here in US, it's just ridiculous. I spend less time taking care of the patient, but more time actually writing the note about it. This is becoming a mess. And of course, we're going to come to it, how policies changes are actually trying to address this issue. But it is ridiculous that I am becoming a physician and spending more time in front of a computer screen as compared to in front of a patient. And these are things that are going to be changing, and virtual care is one of them. Ambient intelligence that I talk about, artificial intelligence, etc., is going to help. But clearly, we need to make policy changes in which we can see physicians, clinicians spending more time in front of the patient rather than in front of a screen. Nurses have the worst. They have to document everything as if they're actually on a cashier's machine and documenting everything like a medicine and an IV bag, etc., rather than actually going into the room and taking care of the patient. So this is a huge issue in terms of bureaucratic tasks. The second is clearly spending too much hours on the workplace. There's some things that you just can't control. Like being an ICU physician, there are 12-hour shifts. I mean, I cannot find an 8-hour shift anywhere. And it's exhausting when you're doing a 12-hour shift on 24-bed neuro ICU. So you are spending a lot of time at work, and that is extremely exhausting in terms of that. And respect from administrators, this goes back to this idea of cynicism that, they feel like you're just an employee, you're going to clock in and clock out. And we did not end up in the field of medicine just to take care of bureaucratic tasks and be there just as an employee. We are inherently people who are trying to impact lives, and therefore when you are treated just as an employee, you feel disrespected and you feel like you are not performing at your best. It is also important to understand that how severe is the burnout. According to this survey, again done by Medscape, you would see that about 50% of respondents have said that it has a severe impact on their work life. So it's really a big problem, and it's a severe problem. Now, how to reduce it? Now, the first and foremost is, number one, as you can see, is financial compensation. So let me put things into perspective. First and foremost, nurses. Clearly, they're paid less. They should be paid more, period. There's no question about it. Done, move on. They are severely underpaid for the amount of work they provide and the value they provide to the societies. Now, in terms of physicians, people say, oh, they're actually very well paid. That's actually a double-edged sword. First of all, sometimes it's not true. Clearly, pediatrics and family medicine is the prime example. But if you really look at even highest paying grossing physicians, the amount of time that they took to actually go through the training and come to the level that they're about to actually make some money, it's huge. For example, I started truly making money sort of in neurocritical care stroke at the age of 33. However, my brother, who's a software engineer, started at the age of 23. Just by comparison, 401ks are very going to be different. The cost of opportunity that is differing is about $1 million in today's estimates. benefits, $1 million. So just because he started early in his career, the accrual is significantly huge. And the cost of opportunity, people forget about it, is huge as well. And then the question still is not just the financial compensation. It is basically that the amount of sacrifice, the amount of time away from family, the amount of training, etc., that is needed, the amount of attention to detail is needed. Do you really feel well compensated? So the problem again is financial compensation. It makes a huge impact as far as how to reduce burnout. And of course, there are other variables that are listed, and of course, they're listed on the Academy website as well. Now, these two do differ from a men to women compensation wise is concerned. Believe it or not, work-life balance is a bigger men issue than a women issue, and it's not because of that. And we're going to go into the next section, because women actually do have better work-life balance juggling capabilities, believe it or not, and therefore they are masters at it. And I don't know how they do it. I have great respect. But again, those two issues, including work-life balance, is the key issue, and the second one is compensation. Now, how do you alleviate burnout? The key problem is reduced number of work hours. And in general, I mean, we think about 40 hours a week. Physicians are working at an average about 65 to 70 hours. It doesn't look like that. Believe it or not, they are putting in pajama times at night just to complete their charting. Sometimes the work setting in itself needs to be adjusted, for example, and that's what I did. I mean, I personally moved away from in-person setting to virtual care, telestroke more so, just to reduce my dependency, my sanity, and help me put some time towards my family, given now that I have 2 daughters and they're aged below 5, and I wanted to make sure I spend more time with my family. So again, this is one of those things that in which you can get flexibility and control, and not everyone has that choice. Now, clearly, policymakers have taken notice of this. And one of the key things that they're trying to decrease is the bureaucratic burden on physicians, clinicians, nursing, etc. Patient award paperwork is an initiative by CMS that they're trying to curb the amount of documentation that is required, and the documentation that is actually done is more fruitful rather than garbage in, garbage out. Again, make sure you look at the updates at Academy website, because this is sort of a living document. As more information that I get from different sources, I make sure that I update it on the Academy website. Thank you. If you save a life, it is as if you saved the life of mankind. Please make sure you like, comment, share, and subscribe to my YouTube channel and my newsletter. If you want to get in touch with me, the best way is to go through Twitter or via LinkedIn. Also, make sure you follow the Academy website for regular updates. Thank you so much.